A favorite musical is coming to St. Louis, and of course, Studio STL and Fox 2 wants you to win some of the best seats in the house. Pretty Woman, the musical, is based on one of Hollywood's most beloved romantic stories of all time, and it's coming to the fabulous Fox Theater, so mark your calendars. It's coming November 16th through the 28th, and you can register to win 4 VIP tickets on our contest page at fox2now.com. Well, October is Breast Cancer Awareness Month and a good time to really stress the importance of a breast cancer screening. Dr. Summer Chaudhry is the medical director of the Breast Health Care Center at Missouri Baptist Medical Center, and she's our guest today to really explain what every woman needs to know when it comes to these screenings. Dr. Chaudhry, thanks for being here with us today.
Thanks for having me.
Absolutely. And let's really start things off with what is a mammogram and who should get one?
So a mammogram is an imaging study that allows doctors to see if there's any abnormality in the breast tissue that signals that there is a cancer that has occurred in the breast tissue. So we can see things like masses or lumps. There's some other indicators of breast cancer on mammograms, such as calcifications or tissue retraction or distortion of the normal appearance of the breast tissue that can indicate there's something going on. So it all starts with the mammogram, which is basically an X-ray study of the breast tissue. And then your doctor may or may not want some additional imaging if they notice there's an abnormality on the mammogram.
So getting those mammograms are so important. Who should be getting mammograms?
So the Society of Breast Imaging and American College of Radiology recommend that women of average risk, in other words, they don't have a significant family history, should begin screening mammography at the age of 40. And they should do it annually. So even if you don't have a symptom, even if you don't have a family history, and you're in your usual state of health, keep it on your calendar. Your birthday is a good time to get it. Some people like to get it in October, whatever works for you. Remind yourself to try to get that screening mammogram once yearly. And women that do have a family history of breast cancer, of course, they need to have a formal risk assessment done. You can talk to your doctor about that, and they might benefit from additional types of adjunct screening, such as ultrasound or MRI of the breast. But for average risk women, I would recommend mammography beginning at age 40.
Also, because those precautionary methods really do kind of help you in the long run. Where can these mammograms be done?
So these mammograms are done, at many of the local hospitals. They're done at imaging centers. I would talk to your doctor about it, and I would remind patients that, we're trying to catch cancers when they're not symptomatic, so that they're small, that the treatments and therapies that are available are actually going to impact them before they actually spread to other parts of the body. That's the whole point of mammography or screening mammography. I would also caution that if you have a lump or some other unusual symptoms, and you're younger, then of course you need a specific diagnostic mammogram that can also help us to evaluate your breast.
So, we've been talking about mammograms for the past couple of minutes, but are there any other preventative screening measures that can be taken to detect breast cancer?
There are some other screening studies for patients who have family history. There's breast MRI as well as ultrasound. And again, those are some higher level screenings that we recommend in patients who have a higher risk of breast cancer, which is calculated after they do a formal risk assessment. In terms of preventing breast cancer, I would recommend, maintaining a healthy weight, eating a healthy diet, limiting postmenopausal hormonal replacement therapy. Breastfeeding is actually protective against breast cancer, and exercise helps to prevent or decrease your risk of breast cancer. So those are all things that you should keep in mind.
And I learned something new I didn't know about breastfeeding and preventing breast cancer. What are some other common misconceptions of mammograms or breast cancer?
Well, I would say that, women will think if they're breastfeeding that they can't get their screening mammograms. That's not true. I think, if you are due for your screening mammogram, you need to talk to your doctor, and, you should be getting screened normally. Women are having children later and later in these days, and And screening mammography should be initiated, by 40 years of age for average risk women. So you can do things like that.
Well, thank you so much, Dr. Chaudhry. We'll have all this information on our website, studiostl.tv. The Breast Healthcare Center is at the Missouri Baptist Medical Center. All their information is right there on the screen. Again, we'll have it online on our website as well. Don't go anywhere. We'll be right back.